The next award is the 2025 Henry M. Stratton Medal for Clinical Translational Research, which is being presented to Dr. David Williams of Boston Children's Hospital and Dana-Farber Cancer Institute, Harvard Medical School. He is honored for his vital contributions to the understanding of hematopoietic stem cells and viral vectors, which have led to landmark clinical trials of gene therapy for inherited blood disorders. Dr. Williams is a former ASH president and pioneer of gene therapy, having been the first to demonstrate gene transfer into hematopoietic stem cells in mouse models using retroviral vectors, and his research laid the groundwork for RFNCH296, or RetroNectin, a standard reagent that's used in gene transfer. Dr. Williams' work directly enabled the development of groundbreaking gene therapies for severe combined immunodeficiency, chronic granulomatous disease, cerebral adrenoleukodystrophy, and sickle cell disease, offering additional therapy options and renewed hope for patients living with these debilitating blood disorders. His laboratory focuses on GTPases, proteins that play a crucial role in cellular processes, and identified the molecular causes of 3 different rare hematologic conditions due to mutations of RAC2, ROH, and septin-6. Congratulations, Dr. Williams.
Well, thank you very much for this award. Thanks to the nominators and the selection committee. I want to start by just recognizing ASH as a major driver of support for hematology research. You know, next year will mark the 50th anniversary of my first ASH meeting, in which I presented an oral paper in 1976 as a first-year medical student. So since then, I've been associated with ASH all those years later. As mentioned already by both previous award winners, the award really recognizes trainees. And I've just been blessed over many years with outstanding trainees, some of whom still are part of ASH in leadership roles and at the journal. So I thank them for their dedication. You don't have success in science without mentors. I want to recognize those people. Bob Boehner and the late Larry Boxer, whose wife Gracie is here with us today, basically accepted me off the cornfields of Indiana with no experience, nothing to offer them except my enthusiasm and interest in science. And that set my career from then on. And in Boston, Stu Orkin, Sam Lux, Ora Platt, and most importantly, David Nathan, who has been my mentor steadfastly since the early 1980s and still routinely tells me what to do at the age of 96. I've had the privilege of having leadership roles in 3 really outstanding institutions, Indiana University, Cincinnati Children's, and Boston, and had terrific bosses that I want to recognize. Tom Boat in Cincinnati, Gary Fleischer in Boston, and Sandy Fenwick, who's recently retired as the CEO of Boston Children's Hospital. And most importantly, wonderful collaborators throughout my career. Also, funding is so important, and I've been blessed to have NIH funding continuously since 1986. 16 years of funding from the Howard Hughes, and funding from NIAID, NIDDK, NHLBI, NCI, and the Hood Foundation. And I'm grateful for that continuous funding that has allowed our lab to do basic science. Last but not least, my family. My wife, Cindy, of over 50 years, and my daughter, Emily, who's a pediatric cardiologist at Emory. They've both supported my commitment to medicine and to science. As you know, requires long hours and giving up much, and they've done that with a great deal of support and joy. So thank you again to the ASH for this wonderful honor.